You didn't step into public health by accident. Something in you cared deeply about people, about health equity, about communities that are overlooked, about solving problems others ignore. Maybe you were inspired by a professor or a book, a documentary, a lived experience you had, or even just a desire to make a difference in others' lives. But right now, it might feel like you're carrying too much. The headlines don't stop. The job market feels shaky, and politics makes the work even harder. And as you move through classes, internships, or early roles, you may ask yourself, did I choose the wrong field? The heaviness is real, but so is your why. And this is why I'm going to share this today. Hey everyone, Omari Richins, CEO and founder of the Public Health Millennial, where we help you learn, navigate, and transform your public health journey. Be sure to check out all the links below, like, subscribe. The weight you feel right now is real. The weight many of us are carrying right now is real and heavy. But that weight is also a reflection of just how deeply the world needs public health professionals right now, how much the world needs people just like you. Funding cuts and political pushback are threatening essential programs, creating instability and uncertainty in organizations that are already stretched thin. Some of the very roles you were trained for may be paused, defunded, or restructured out of existence. Burnout and workforce shortages are at crisis levels. According to the 2024 PH Win survey, 71% of state and local public health workers report experiencing at least one symptom of burnout, and 1 in 5 experience near constant symptoms. This isn't just burnout in the margins, it's a majority of the workforce carrying strain and still showing up. Cut. Job competition is intense. Early career professionals are not just competing with fellow graduates, they're often going up against the global health professionals and federal professionals that were just released from their jobs and sector switchers who don't mind getting unpaid work once they're staying in the field and staying committed to this work. If you felt disillusioned or even questioned whether you made the right choice, you're not wrong. The environment is tough. The political headwinds are fierce, but challenge doesn't erase purpose. It refines it and helps you see your vision. You chose public health for a reason, and that reason still matters. The communities you want to save still need you. The injustices you want to address are still there. And despite the pressure, the impact you can have is powerful, personal, and still possible in today's world. The myth of maybe I should have just chosen something else. In tough seasons, it's easy to think, did I make the right choice? Is public health even worth it anymore? You're not alone. Just remember that every movement that's ever mattered has faced resistance. The civil rights movement, the women's rights movement, the battle for healthcare access. We're still fighting, clearly. Look at the government shutdown. Each was met with setbacks, people burning out, and some left. But enough people stayed and persisted, and change happened. Public health is no different. It's hard, it's political, it's underfunded, but it's also powerful, necessary, and life saving. If you feel disillusioned, that doesn't mean you're failing. It means you care. Take a pause, reflect, reconnect with your why, the reason why you came into this work. We still need you. Your presence, your voice, your perspective. They matter now more than ever. 4 anchors to stay grounded when it feels heavy. 1. Protect yourself with boundaries and care. Caring for yourself is not selfish, it's survival. Define your limits on your time and your energy. Build habits that recharge you. Think journaling, workouts, and spending time with community. Choose spaces and mentors who respect your boundaries and your values. If the systems won't always protect your well being, you need to. Prioritize activities that help you stay recharged and focused for the long run. 2. Reclaim your narrative. Your story matters. Why did you step into public health? Write it down. Carry that with you. What moment or story drew you here? How do you want your work to feel 5 years from now? What communities or issues still break your heart enough to fight for? This isn't just reflection, it's a compass for when things get foggy. Pursuing public health is often hard work, and hard work is hard work. 3. Build networks and allies. Isolation is one of the heaviest weights. Don't carry this work alone. Don't build in isolation. There's value in strengthening your network. Join student groups, professional associations, or communities like our free The Public Health Millennial Collective link below. Seek out mentors who've walked ahead of you. Offer support to peers you're ahead of. You'll find strength in lifting together. Connect with folks on your same career wavelength. Public health was never meant to be a solo act. We need our own community to ensure we can show up for our community. 4. Focus on the small wins. Big goals take years. Small wins keep you moving. Have a vision on your big goals. Focus on achievable ones. Break down large ambitions into micro tasks. Track and celebrate every step forward, whether that's sending one application, finishing a class project, or making a new connection. Reframe failure as data. It shows you what and how to adjust. Momentum builds from action, not perfection. You don't have to do everything, but you should start by doing something. A quick action plan for today. When the work feels overwhelming, the most powerful thing that you can do is take one grounded step forward. Burnout thrives in isolation, confusion, and disconnection from purpose. This isn't about fixing everything today, it's about reconnecting to your why, your one small action at a time. Here are 5 simple grounding actions you can take today. 1. Reconnect to purpose. Write down your why you chose public health, in 1 to 2 sentences. Keep it visible. Put it on your mirror, your phone background, or the front page of your journal. 2. Pick one anchor. Choose one of these to lean into next week. A narrative. What story are you telling yourself? Reframe that. A boundary. Say no where you need to. Protect your energy. A small win. Celebrate progress, not perfection. And networks. Stay in community. It fuels everything we do. 3. Reach out. Message a mentor, a professor, or a peer. Ask a question. Share a struggle, or simply just check in. Connection creates clarity. Continue to build relationships on your network. Speak to someone. 4. Reflect on a hard moment. Think back to a moment that tested you in school or in work. Write down at least 2 lessons it gave you about yourself, about the field, about what you value. 5. Normalize the nonlinear. Say this aloud or write it down. My path isn't supposed to be perfect or straight. Growth looks messy sometimes, and that's okay. Keep this reminder with you that your journey is your journey, non-linear and all. You didn't choose public health because it was easy. You chose it because it mattered to you. The heaviness you feel right now, that's not a sign you should quit. It's proof that public health work matters. Closing thoughts. You're not feeling because it feels heavy. You're just human. And you're in a field that asks for courage, creativity, and compassion. So hold tight to your why, set boundaries, celebrate your small wins, and stay connected in community. We need you in this work, not perfectly, not endlessly, but persistently. Because public health doesn't move forward without people like you. People who care, who show up, who stay rooted, even when it's hard. I hope you enjoy this message. Please let me know in the comments below. Leave a like, subscribe, check out all the links below. See you all next week. Peace, everyone.